Yep. I think no. This is Fred.
Oh, I
This
guess
is
I
our
had
director. This is our. What is it?
No, I work for instructional design, you know. I create videos for instructional
Okay, cool.
Yeah, absolutely. No, we're here to help. Just so you know, I'm streaming it now on YouTube. I know it's early, but it's, people kind of jump in and can't find it, so I'm just open.
Oh, yeah. That's great. That's
So,
perfect.
But if it all doesn't work, I'm recording it, better version.
It'll be just fine.
So you get the mics, turn them on.
Yep. And I checked all this stuff. Yep. Yep.
Perfect.
Yep.
Oh, looks like we're getting some close. Break away with this,
Oh, I can't break it anymore.
You don't need both. I took a fall last night.
Oh.
Fall good. You're a kid, you fall, you're like,
I ain't
rubber.
gonna spec
Yeah, I was like, yeah, a little fall. It's terrible. Nice to meet you.
Yeah.
Nice to meet you.
Remember, I get that candy bag.
Yeah, if it fails. Yeah, I'll leave it for you. My little feet running away. Yeah.
So Mindy and so you guys all remember that you're gonna sit on the ends, right? On the middle. Okay.
I wonder what she said. It was like a shit.
No problem. We're coming. Hi, I'm Ann. Nice to meet you. I have met you. Hi, nice to meet you. Hi, I think I've seen you before. Didn't you come to when we opened up? I think when we opened up the lab, yeah. You were here, I remember.
Don't headbutt. Please don't headbutt.
It's an exciting.
That's a good point.
She's always excited.
And this is Professor Fred.
These
are-
Yeah.
Oh, you did, okay.
Can you
So
aim
who's
it?
the dancer?
This one. She's the
Oh,
dancer.
can you show me your steps?
Can you show him some Honey Buns and Necklace?
Let's see.
Oh,
There you go.
Yes. Okay. 1, 2, 3, 4, 5, 6, 7, down. 2, 3, 5, 6, 7, go. Beat,
wow.
Wow.
beat, beat. 1, 2, 3.
Oh, it's getting better.
Awesome.
This is her Friday night.
Yes, very
That's awesome.
good.
So much fun.
Very
Dance is so
good.
much fun, isn't it?
Right. She had to eat last few weeks ago. So she ate it in June.
Perfect.
Nice. Fantastic.
I remember you. I really thought that you were going to come to school with me. I know she did. I know she did. I know.
Nice to meet you too. Yeah.
Most of it's pretty good.
Except for that
I remember the first time we had a meeting together, and I thought, oh, I've never had a meeting with a mom before. It was fine. It was fine. Oh, well, I know. And she told me just the other day that she wanted me to go to orientation with her, and you said it was weird. Good for you. I know. She is amazing, and everybody's part of the program. And she's not the same girl. Not the same girl.
All of your motivational emails, it was just like pouring us into all that.
It's been a joy, and it was fun. And I know that maybe it's time to go live your life. It was wonderful to see OC after the ceremony and everything.
Okay.
So bring this guy over. This guy. Oh, really? Thank you.
For everyone.
No. Hi, nice to meet you.
Meet you.
Really? Well, they can't. We've heard a lot about you too. I wasn't pretty well. Pretty good. I kind of forgotten the bad words, but I wasn't sure that you existed, but there you are.
She had her doubts, but
Nice to have met you, and we'll see you after the ceremony. And I'm sure we'll be taking lots of pictures.
oh, and Dr. Hart, we had this
Yeah. Oh,
where
yeah.
all of the friends
That's fine.
they wanted
It's yeah, everything would be cool. Hi.
This is beautiful. And it's exciting.
It is. Thank you for coming.
Absolutely. And I'm happy that you're
I think we'd like you to say. You say whatever you like. Whatever you'd like to say.
Yeah.
But thank you. Thank you.
Yeah, this is beautiful.
Thank you.
Yeah.
What? Oh, yeah. She's sort of like. There. I'm glad. I couldn't see anything. I was just like, oh. Hi, dear friend, how are you? It is so wonderful. So wonderful to see you. This is Fred. Oh, yeah. She's even taking so many things. I can't even. Well, you say oh, Charlotte's here. And then let's hit the flowers on the. I graduated. Yeah, still. I just don't know if it's like the end and forget that they're there. A lot of
너무 결정됐어? 너무 결정됐어? 야, 위치가 안 돼? 위치가 들고 있어? 괜찮아?
Oh, that guy. That guy.
Why don't you maybe just go radio ready?
I emailed and invited him. Yes.
First, yeah. What she first?
Oh, yeah. No. So like the first one that I had, the first one that was this. That was in the second now. Oh, yes. Yes. You never forgot. Oh my God. Of course, yes. No, not because
They just kind of
Okay. You can sit wherever.
I was worried I was inside the wrong side. What was I doing last night? The sleep.
Oh, that's cute. Now
So
that's
we're ventilating to the ears,
that's.
which was great.
Oh, this one. I never thought of it.
Here. Here.
Okay, so when we come up, are we?
Come on, just stand up. And then you can start. I think every is Okay. Fred Golia, and he is the director, and I'm the clinical director. And we're going to get started with our program. And I hope you enjoy it.
I know.
Is everybody? Oh, you're still taking pictures.
Everybody gets.
Okay, graduates, please have a seat.
All right, thank you for the two respiratory therapists who can figure out how to turn on the microphone. But we got it. Hi, everybody. My name is Fred Golia. I'm the program director for the Respiratory Care Program. I've gotten to meet a few of you, but I hope to meet all of you before the night is over. Thank you for coming. I am super excited to share with you. This is just a fantastic occasion for me. This is, of course, graduation for this class of respiratory therapists. So this is 17 brand new respiratory therapists ready to come and work in the hospitals around town. Several of them are already employed. And I want to say congratulations to you all. Very fine job. So this is, it's actually a pretty special occasion for these guys, but it's also a pretty special occasion for us at Highline College. Not only are they graduates of the Respiratory Care Program here, but they're also the inaugural graduates of our baccalaureate in Respiratory Care Program. So these guys are the first of the first, and that is a huge accomplishment. So that's, it's a big accomplishment, but I want to just kind of emphasize to you all just kind of how big that really is. I mean, not only did they go through all of the struggles and the work to learn how to get out there and be respiratory therapists and save lives every day, but they also had to do it under some pretty adverse conditions. I don't know if you guys all know this, but sometimes these guys were studying in their living room, they were learning in their bedrooms. They didn't get to come to class. They didn't get to do all the normal things that we do with respiratory care students to help them train them in the craft. In fact, I've even been told that some of these guys were learning on lab equipment in their living rooms. So don't be surprised if a few months from now you might find a nasal cannula or something underneath your couch. You won't know what that is. I think that just speaks to how strong of a group this is, how dedicated they are, and how willing they are to sort of face up to whatever the task is to get the job done. They had to go through tremendous amounts of adversity to get to this point. We had change the rules every 5 minutes about COVID. We had vaccination requirements. We had all these things, all these hoops that they had to jump through. And you guys did an amazing job getting through all of that. Another sort of really important thing to point out is that behind each of them are all of you. So thank you very much to the friends, family, and loved ones that are in the room that helped these respiratory therapists get to the point where they're at today. So thank you. So I wanted to share just a little story with you guys. And this is just a story about a respiratory therapist. About 10 years ago, my daughter was 8 years old. And she was a normal, squirrely 8-year-old girl. And one day she got a fever, and she was kind of sick. And so I stayed home from work with her, and I was watching her throughout the day. And as I was watching her, she just was getting more and more sort of tired, couldn't get up from the couch. Respiratory rate was increasing. Her heart rate was increasing. So about, some of these guys are going, uh-oh, some of the students. And so right about 8 o'clock, because bad things always happen to parents at 8 to 10 at night, I brought her to the emergency department. And I'm sure many of you have been in this same position. And when we got there, they started to monitor her, and she was tachycardic, she was tachypnic, so her breathing rate was fast. Her oxygen levels were kind of low, they were about 92%. And when they examined her, we all kind of noticed she had some retractions, some little, so that she was definitely having some respiratory distress. So we got a chest x-ray, lo and behold, she had pneumonia. So my baby had pneumonia, right? This is kind of a hard thing for a respiratory therapist. Well, throughout this process, they started to give her some treatments. She got put on a continuous albuterol setup, and these guys know what that is. And then, lo and behold, at one point, her oxygen set went down. The alarms were going off. Her set was like 85, 84%. And it was after they had started this treatment. And so, of course, as a respiratory therapist, I'm kind of like, ah! But as a dad, I'm even more panicked, right? And so it's very different to be a dad versus being a healthcare provider. But the thing that really sort of made that experience work for me was a respiratory therapist. And it was a young respiratory therapist, only, had been out for a couple of years, but she was so level-headed and so calm in that moment that it gave me confidence to be able to sort of sit there and be a dad while everyone else was doing their job to take care of my daughter. She was a Highline. And so for those of you that don't know, I've been teaching for about 20 years, and most of that I taught at a different college. But so it was amazing to kind of meet this young respiratory therapist who was able to just jump right in and get that job done and give me the confidence in the system that I needed to be able to be a dad in that moment. And the reason I tell you this story is because I want to tell you that I know that these graduates are ready. They can do that. They're ready for those moments. They're ready to be the voice in the voice of calm in the fray. And I know they don't feel like they are, but they're ready. We've trained them. They've been through many, many hairy situations in the hospital, and they are ready to go. So, grads, give yourself a pat on the back. I know that you're ready. I'm going to kind of wrap up my own comments because I don't want to, I don't want to occupy the whole night. But I do want to say that this is one of my favorite moments of teaching, and this is why I continue to do it. It's because today I get to stand up here and I get to tell you all, you're no longer my students. Now you're my colleagues. Congratulations.
So I want to tell you why we do a pinning ceremony. And many of you may have heard that this is something that nurses do, and that is true. But there are lots of other programs and professions that have a rite of passage. And that's what this really is. Pinning is something that says you are part of us. You have joined us. You are joining the profession that we have all loved. And we're darn proud of each and every one of you. And the other thing that I would like to say before we get too much further into it is that family, friends, those of you that are out there that have supported our students and your students, we thank you. Because we know without you, they wouldn't have been able to come to school and get through it. Without your support, without your drying tears, without your way of loving them and knowing that they can do it. I know they greatly depended on you. And I've had the great privilege to have known them for all 3 years. And I can tell you that they are remarkable individuals, and I know that you know that. But I'm not sure that you realize that they're going to be a little bit different than what maybe you remember them as. They've gone through a lot, they've seen a lot. And so without further ado, we would like to get the program underway and understand that when we are pinning them and when you're pinning them, that they are joining us. And for us, it is a huge honor. So, the first pin tonight goes to a person that we all know. And that person is Professor Nikki Bly. And the reason why we are giving Nikki the first pin is because without Nikki, we would not have a bachelor's program. This would not be a BAS program. I only saw a portion of what she did, but what she did to get us to this point is absolutely indescribable. And she couldn't be with us tonight, but I know that she's watching. Hi, Nikki. So the first pin of the Bachelor's of Applied Science in Respiratory Care goes to Professor Nikki Bly. Oh, it's a good one, Nikki. You'll love it. The second pin is Professor Bob Bonner here. Yeah, the second pin is going to go to Professor Bob Bonner. And I can tell you that all the faculty, except for Professor Fred here, have had the pleasure and the honor of being taught by Professor Bonner. And so we would like to give the second pin to Professor Bob Bonner.
Well, that's a surprise.
on the pin, so he's carrying it. I would next like to introduce the administration, at least by name, and we do have Professor Dr. Emily Lardner here, who is the Vice President of Academic Affairs. But we have a pretty amazing administration here. They've supported us all along. Without their support, we wouldn't be up here. And so that is Dr. John Mosby, Dr. Emily Lardner, Dr. Paulette Lopez, Dr. Tanya Powers, and our division chair, Darren Smith. So Dr. Lardner would like to say a few words.
Thank you so much. It's an honor to be here and to speak on behalf of our administration. My heart is overflowing with gratitude. I heard Fred use the word courage. Graduates, I need to tell you that during the pandemic, images of you learning to be respiratory therapists, going into clinics, learning how to work with patients, showing us that we can live and learn and keep ourselves and each other's reasonably safe in a pandemic that terrified everyone. Images of you helped our community know that we could go forward. So I have just incredible gratitude to all of you students for showing us what courage looks like in action. I have as much gratitude for your teachers who never signed up to teach you how to do these life-saving, life-changing skills in a pandemic. They never knew that they would become Zoom masters and internet masters. They love people. They understand bodies. They understand our embodied body selves. They're brilliant with us as people. So for them to be able to share their gifts and talents with all of you in a world they never imagined, I have huge gratitude for your teachers who helped you learn these skills that save people's lives. And then, as my colleagues have said, to the families and loved ones who supported your students as they worked so hard to learn complicated, detailed, precise, doesn't come easy, but people's lives depend on you knowing it, learning all those things, and the energy it took and the love you gave them that helped them get through. My heart is full of gratitude for that. So it is an honor to witness this celebration of your accomplishments. Thank you, Mom.
We had one other thing that we wanted to give tonight, and that is to Mr. Daniel Romans. All the students know him. He is our lab technical, I don't remember what his title is, but really he's like a can-do-all person. And we depend on him a great deal. So we will be giving him a pin when we see him. He couldn't be here tonight. So, without further ado, oh, it's not showing. I'm sorry, that's my fault. There it goes. That's Henry. Sherilyn, can you stand up? She made the video. We won't talk about the goof ups in it, but all right. So if there's any managers or clinical instructors up here, please come forward. So come on up here.
They're not all coming up?
Turn the light. Rose. So most of the clinical instructors can't be here tonight, and they're working. But I want you to know that without the managers and the clinical instructors, we would not have a program. They teach the students, they support the students, they help them to learn. We teach them the stuff in the books and the stuff they have to know for testing. But the instructors are the ones who really help them grow and develop. And as the director of clinical education, my job would be immensely worse, immensely harder if I didn't have the fantastic clinical instructors and managers that have supported our program for all these many years. So we have two of them up here now. This one is Betty Hansen. She is the instructor from St. Anne's. And then we have Rose Scott, and she is one of the instructors from Harborview. And so it is my great honor and privilege to pin them both. And please give them a round of applause. So the students will now get to pin the faculty, which is us. So I will announce each of the faculty. I can tell you that it is one of the greatest things about coming to work here is that I am working with the most amazingly wonderful people. And so we will start with the student who is going to be pinning Professor Greg Williams. with you. Professor Paulo Sacabagzi. Professor Chris Alabazay. And me. All right.
Ready?
Are the graduates ready to be pinned? All right. All right, so God knows that I've been trying to work on this, and so I apologize to her family because I'm sure you've never heard her name pronounced like this before. Mama, when? Did I do it? lovely student. She's always been very polite and quiet until the day we started talking about music. And we found out, yes, I know, I remember. And we found out that she likes K-pop. She is going to make an excellent respiratory therapist. She's very conscientious, and she has a beautiful smile. You know, we've all seen them, your students, with their masks on, so we know who they are. And I realize that when you saw the movies, you may not have recognized them, but that's how we've gone to know them. And so there she is. All right. Hi, Mindy. Mindy Grant. Mindy's started out being one of those really quiet students. And the more we got to know her and the more I could make her laugh, the more fun that it was. I also found out that Mindy likes Animal Crossing. And, and I was told that really what you do at Animal Crossing is just go and pull weeds. And, oh no, she says no, but that's the gentleness that is really Mindy, just harming no one and being an inspiration to all of us. Congratulations. I win. And you could go to class and you could really be in a bad mood, but if you watch Ty smile once, that mood will disappear. He is a joy to have around. He is. Congratulations, Ty. Hey, boy. Yeah. graduate as a respiratory therapist. And that is a huge honor. So congratulations, Boyd. It is great to see you. I see. When I was asking the other faculty about different thoughts about different students, the first thing that came to almost everybody is that Maisie will help anyone. She is kind, she is considerate, and she goes out of her way to help everybody. Madison. When I think of Madison, I know that if something needs to be done, Madison will do it. She'll get up, she'll do it, that's it, over and done with, move on. And she's great to have around for that. She never always takes personal responsibility for everything. And that quality will make her great. So. Yes! It's almost like I'm bilingual. I have the great privilege and honor to pin Lydia. She is an absolute delight. She doesn't turn in papers all the time. Sometimes I have to, email her once, twice, 10 times. But that's a small price to pay for having Lydia around.
Yes. There's nothing up there.
Well. There. The rest. And cut. And is one of those students that is just naturally curious. And there are times when we would debate certain things. But her curiosity was always really rich, and I enjoyed it very, very much. Very good, thank you. Congratulations. San incredibly polite and kind and soft-spoken, but she's also determined like you would not believe. And her success is because of that determination. Congratulations. I almost skipped Hannah, didn't I? When Hannah would raise her hand and say, Dr. Korn, I have a question. There were times when I really felt like hiding, but it was because of Hannah's curiosity and trying to really understand things. I actually will miss her a great deal as she's asking her questions to fulfill her curiosity, which I'm not sure that I ever actually did. Got it? Great. Oh, okay, yeah. My. I've known Maya a long time. She started the program and then the one thing that the clinical instructors would always say about Maya is that she is great with patients. She's worked a long time in the hospitals, but her kindness, the patients always really appreciated it. And we're going to miss her. Congratulations. That's you. I have the great privilege again of pinning another student, and Ilona and I have had a lot of serious conversations, and we've had a lot of laughter. And I will miss her a great deal. She is a fantastic person, and I know the world would be a better place. Congratulations. Simpson. One of my favorite things to do was to make Samson laugh. Because sometimes he would be so serious, and you could make him laugh, and it was just a great deal of fun. He has worked very hard to get where he is, and we're very proud of him. How do you do it? positive attitude. And it's made teaching in the classroom a lot more fun, except they're not going another certificate that Sunday. Sorry. And so she would be okay with that. So anyway, congratulations, man. Haley. I am very privileged to pin Haley. I've known Haley for a long time now, and I have seen her grow so much over the course of this program. And congratulations.
Thank you.
Miranda is so considerate that she didn't tell me for 3 years that we've been pronouncing her name wrong. And when I tell everybody else, they go, really? That's how you say it? She is a lovely, kind, considerate person, and we're going to miss her a great deal. Is there someone else? Oh, yeah. Courtney. When I think of Courtney, I think of someone who does not give up. Not ever. She keeps going, she gets knocked down, and she gets back up again, and she comes back stronger each and every time. Congratulations. I wanted to say a couple words in closing, and when I was introducing the students, I was thinking of saying them beforehand, but then I decided to wait till after. And what I want the students to know, the graduates to know, that you faced fear when people really didn't know what was going on. You went back into the hospitals during COVID, during the height of COVID. And yeah, we were afraid. We all were. And we worked with the hospitals and made you as safe as we could. But I never heard any of you, not one of you, say no. I never heard any of you say that you didn't want to go, you were too afraid to go, even though that would have been understandable. It takes a lot of courage to become the person that you should be. that you are. And I know that we could talk forever about how bad COVID was. But it did one thing tremendous, I think, for this class. It showed in each and every one of you what you were made of. You may not have been tested as much. We haven't had that period of time. And I cannot tell you how immensely proud I am of each of you, of knowing each of you, of seeing each of you. You've all been to my office. We've shared lots of laughter. We've shared some tears. But I knew that you had everything that you needed right there inside of you. And so as you go out and you join our profession, most of us are not too scared. One of the faculty members did faint, but she got over it. I want you to know that you will make a difference in the world, and we are better for knowing you. I am better for working with each one of you and for knowing each one of you. So I'm not going to give you any advice because you don't need it. You'll make mistakes and you'll try something different. So congratulations, my friend. I will miss each and every one of you immensely. And I know that you will make us proud for the many years that you are in this career. Congratulations to everyone. Thank you. So, because we're supposed to be wearing masks inside, you can take pictures outside, you can take pictures in the vestibule, you can just kind of move around and enjoy yourself. And thank you so much for coming tonight. Thank you for being part of this celebration. I still have that photo for you. We have flowers. We have flowers to give everyone, Stephanie from St. Anne's brought roses for everyone, so please come up and get your rose.
Where's the other girl? She's like happy at you. Right? Just make sure there's not a board on. Thank you so much. Where are you working? Linda's gonna be so Thank you. Yeah, this was what I Awesome. Good for you.